Most notably, we're joined by one of our wonderful faculty, Kim McPherson. Thank you so much for being here. We'll give her a proper introduction in just a moment. And we will talk about Berkeley Public Health mission, our vision and values. We're going to go over the program design. So we'll give you an overview of the structure and timeline of the online MPH. And then we'll hand things over to Kim to talk specifically about our health policy management concentration, which is really the focal point of this information session today. We will go over our fees and the scholarships that we offer for the online MPH. We'll talk a little bit about admissions. We'll talk about some of our student outcomes. We have graduates and alums of this program are doing incredible things in the community, so we'll hear a little bit more about what that looks like. And then we'll offer some time for Q&A at the end. So, of course, feel free to send questions into the chat, but we will make some time at the end to go over any questions you might have. All right, so we'll kick things off with introductions. My name is Elise Rudolph. I'm the Director of Online Admissions and Recruitment. I use she, her pronouns. I'm joined by Stephanie Nguyen, who is our Online Education Recruitment Manager. And we'll introduce our guest of honor, Kim. All right, so Kimberly McPherson is the Executive Director of Health Management and a Distinguished Teaching Fellow at the Haas School of Business. She is also the Faculty Program Director and a lecturer in the Health Policy Management faculty group at UC Berkeley School of Public Health, specifically in our online MPH program. She teaches the healthcare finance course in the online MPH and also teaches the healthcare strategy course for the residential MPH program. And finally, she is co-director of Berkeley Center for Health Technology. So really an incredibly distinguished faculty member. We're so honored to have you on the call and excited to hear a little bit more about the what we call HPM, Health Policy and Management concentration. All right, so to get into UC Berkeley Public Health mission, we believe in healthy people locally and globally. We want to extend Berkeley's reach to improve population health, especially for the most vulnerable, and provide tools to address pressing public health challenges in our time. We do that through innovative and transformative online learning with what is a rigorous and interactive curriculum. We offer a flexible educational experience. It aligns with the needs of working professionals. So this is absolutely a degree that's designed for folks who are working, have families, have other obligations outside of school. And really our goal is to empower public health change makers to improve health where they live in real time. And I think this is one of the core tenets of the, why we offer the online program and have offered it for the last 12 years. It's so that folks actually can have an opportunity to impact public health in their communities where they live and work while they're in the program and going forward. Our values are service in community, showing up with authenticity, growth rooted in justice and equity, cultivating connection through learning, and centering wellness. So we really believe in you centering your wellness as you seek to improve community health as well. All right. And I'll hand things over to my colleague Stephanie to talk a little bit more about the logistics of the program.
Thank you so much. The units to complete our program are a minimum of 42. The time of completion for our program is typically 27 months, and that's 7 semesters all the way through. Average units taken per semester are 6 units, so that's typically 2 classes. The type of degree that you would receive is a professional MPH. The format of our program is 90% online and 10% in person. So there's 2 separate summer visits, or what we like to call campus visits, that are required during your summer terms. The fall 2024 cohort, your summer visits would be in June of 2025 and June of 2026. So they're split, making this more balanced for you and your commitments. Within that, the course delivery is asynchronous, so students can work at any specific time of the day that is most convenient for you, and you're not required to be online at a specific time. There are exceptions where we might have the summer visits. Maybe there's a guest lecture where you might want to, connect with each other, community building activities, but again, most of this online learning will be asynchronous. And the weekly commitment for this, it will be about 15 to 17 hours per week on your course assignments. And this can include recordings or viewing recordings, responding to discussions, some of your personal assignments and so forth. And Kim will be able to speak a little bit more to that a little bit later. One of the things I also should mention before going into the slide is that the office hours are in real time as well. So keep that in mind that, there are no robots behind the scenes here. We are all people here to support you. The program timeline. So as I mentioned, traditionally it is 27 months, 7 semesters to complete the program. So I'm using a guide for the fall of 2024 cohort. Coming into the program, the courses will be taught at full term, which is 15 weeks, and they would be taken concurrently. So 2 classes at the same time. You'll see this in your fall and spring semesters. Anything thereafter will be taken consecutively. So even though you register for 2 classes, 6 units, most likely, the classes are going to be taken back to back. So class 1, complete that, finish your second one, and that completes a term. So you'll see that all the way through until you graduate. Now, if you are in a position where maybe you are able to accelerate it, so this is something with exception that you're able to do, you can complete the program in 6 semesters. So this is what an accelerated pathway would look like, where you would take 3 classes instead of the traditional format as you see here. Another piece to this is that you can take your time as well. So if you need to pace it, maybe you get a new job or an exciting surprise happens in your life where maybe you need to slow it down a little bit and take a break, there's another option for this. Something that I actually want to stress about this timeline here is that there's a flexible pathway to your road to completion. So you want to work with what's best for you. If you are a busy professional, this traditional route can still work for you. We know that our students are working professionals. We know that students have family obligations, caretakers, or just have a lot on your plate that you need balance and you need something that is still steady and pretty smooth sailing. And that's where we step in. We're able to offer a program that is not only going to have a benefit of different options, but something that is going to be able to work to your needs. And that is how our program is set up, is with you in mind.
Thanks so much. And thanks for that nice introduction, and appreciate all of you being here today and taking some time to learn about our program. So as Elise mentioned, I am the faculty lead for health policy and management. That's a role that I have in both the residential program and the online program. So I've been here about 18 years. I'm also an alum. I went through the MBA, MPH program here at UC Berkeley back in the early 90s, and then went on and had a long career in management consulting before returning to Berkeley. And so I really enjoy my role here. It's a mix of teaching and advising and also program management. And it's just a real privilege to be part of graduate students' lives at this key moment when you've decided to invest in yourselves. And I love that with working professionals as well as the students who come to us directly. I wanted to say a little bit maybe about health policy and management and why we're organized this way. So some of you may know that most schools of public health are operated in a somewhat decentralized manner. So we have an epidemiology group. You might have an infectious disease and vaccinology, community health sciences, environmental health. And health policy and management is one of those core areas. And you'll notice when you look at the curriculum in a minute that you'll see that in our MPH program, you'll get exposure to all of those through our core and breadth. But then some of our students chose to personalize or focus in a couple key areas. So we have concentrations in epidemiology and nutrition, as well as health policy and management. We're actually the original concentration who joined the online program earlier in that 12-year history that you just heard about. So for us, we think about all of those systemic levers that affect change broadly. So some people are used to perhaps one-to-one client or caregiving or working in certain settings, and they often, I don't know, develop a desire to have a broader impact at scale. And so a lot of what we try to help people better understand is how to do that. So through economics classes, what are the incentives that are driving, people's behaviors, both in the market, but also perhaps in organizations? We have a whole suite of classes around management disciplines that allow people to more effectively lead and grow through the organizations that they're a part of. Yeah, this is great. This will help me riff on that as well. But generally, what I like to say about health policy and management is it's a very interdisciplinary environment. It's weaving together organizational behavior, some technical areas like finance, economics, policy, in a very structured way, in a thoughtful way, but in this very multidiscipline lens of problem solving, and generally trying to problem solve at scale. So that could be at the scale of a department or an organization. It could be at the scale of government, state, federal, county, global, what have you. But we generally tend to think about and seek solutions that are going to be more broader than sort of a direct intervention. So that just helps maybe level set how the lens. It doesn't mean that we exclude the other ones. It just means that we're also mindful that everything that happens also potentially has other consequences, externalities, and so we try to think about that. And so this slide here kind of gives you a taste of what the curriculum would look like for people who select the health policy and management curriculum. So all of the students in our online MPH take that top row. That's the core and breadth. And as I mentioned, a School of Public Health is made up of key areas, and you'll see all of those represented here. So these are required classes, breadth and core, that everybody takes, that kind of provides that foundation and level sets what everybody brings. And so typically these are taken the first 5 in the first year, moving through, they're generally paired together. You're taking, EPI and HSB and environmental health and biostatistics concurrently. And then in the summer, you take the health policy and management breadth class. And that class is actually where the first campus visit is embedded. So you heard about those 2 visits that make up that 10% of our program that's in person. We wrap those visits within a course. So you're still sort of progressing across the academic component, while you're also coming and building community, building connection to the campus, to your faculty, to the program teams, and getting that chance to be together in person for at least a piece of it. So the summer 1 visit is part of the health policy and management breadth class, and then the second visit is part of the interdisciplinary seminar, which is really an opportunity to weave together a lot of what you've been learning in the core breadth and wrap it in issues of ethics and values and decision making. And so that would be the second visit. So the top line therefore represents what all students do. And then, as I mentioned, students who want to engage in health policy and management do so in our concentration. There's also another opportunity I would add, which is that some students are not in health policy and management concentration. They might be in the interdisciplinary group or even in EPI or nutrition, but they want to earn our certificate and they just take a subset of these classes. So you'll see that top row right there are the health management classes, strategic management, which I have taught in the past, and I do teach in the online, in the in-person, org behavior, and healthcare finance, which I'm actually teaching this semester. Those 3 are all required classes if someone's in the concentration, but also as a trio, they make up the certificate, and anybody can earn the certificate. So you automatically earn it if you're in the health policy and management concentration, and that's actually an additional notation that's made on your transcript formally by Berkeley, but you can also engage in that certificate from any other part of the online program. And some students feel like that management skill set is really what they hope to gain. And they don't necessarily have to fully affiliate with the concentration. For those that do affiliate in the concentration, then there's a requirement to take a class in health economics, and we have 2 options. The first one, health economics, is really the economics of healthcare markets. That goes back to what I was saying earlier about incentives. It's a classic sort of microeconomics class, if you've ever taken one, supply and demand, and how do signals like pricing and other elements affect how things, how organizations behave, and where basically where the money flows. Obviously a very key topic to understand for lots of folks who work in the healthcare environment. For others, though, the economics of population health is a good fit. That is different. That is looking at something at a higher order, looking at what things happen in the broader economy, are there influences that affect health. So the professor for that one is looking more at skill sets around cost benefit analysis versus supply and demand analysis. And he's really trying to help people understand if you make a change in access to employment, or you make a change in basic income, what kind of effect might that have on the health of a population? So it's a very different lens. So they're still both based on economic concepts, but they will get at different things. You can take them both, by the way. Pick one as an elective, one is the required if economics is something you're super excited about, but you would take one or the other for their concentration requirement. And then we also have a requirement around health policy. Most people, I think, take health policy methods. This is a sort of, I call it a toolkit class. I think if you're ever wondered, how does policy come about? What is that process where something becomes policy through a regulatory path or a legislative path or executive order? And then how do you critically analyze and evaluate policy? This is the class that most people take. And then you can deploy that knowledge in any sort of policy area that's exciting to you. For some people, that might be domestic violence. For some people, that might be climate. For some people, that might be the Affordable Care Act. But it really is this baseline toolkit. Some people in the program, though, are very interested in a specific application of policy, particularly things around innovation. And so another option that we have to fulfill this requirement is a course in biomedical innovation policy. And this is really gets deep into, well, how do drugs and devices actually get on the market? What is the regulatory pathway? What do we do when something's on the market and maybe isn't functioning, needs to be pulled back? And what do we do now that we have all kinds of new biomedical innovation, 3D printing of cartilage, AI, and chatbots? What of that should be medically regulated like an actual drug or device? And what are some of the things that we seek to do with regulation beyond just controlling perhaps for safety and efficacy? So those are some policy options there. And then for students in health policy management, there's a real wealth of electives. And this is where you get a lot of personalized advising from the program team to help you shape and form, like, what is the journey that you're on? So up until now, we've really been talking about things that are required, although you can double up on some of this with electives. But after that, different people will go in different directions, and they might pursue more classes in, community health sciences. They might pursue classes in global health. They might want to do more in epidemiology or data management. So that's really where that personalization component comes in from a curricular standpoint. An exciting class that's not on here that we just added is actually a joint offering with the Haas School of Business that I teach. And it ended up being this week-long immersion, a virtual immersion in health policy at the federal level. So we partnered with this organization called the Washington Campus. They curated a week of speakers. We had politicians, lobbyists, people who work on the Hill, people who work in major agencies that affect healthcare, like the FDA, the FTC, Health and Human Services. And it was a small group, almost private interaction with these huge experts in the federal policy arena so that people could really learn a lot more about how that works. And so that was a joint offering that the business school made available to our students, as well as students in the online Masters of Public Administration that the Goldman School offers. And I think it was a real hit, and it really deepened people's appreciation and understanding of that process and gave them great contacts and opportunity to talk. It was also an interesting class because it was interdisciplinary, and it had students from business and law and public policy, as well as public health. And I think everybody really, really enjoyed that. Just one thing I'll mention, just to kind of go back to what Stephanie was sharing about how the program works and what a class feels like, can tell you just a quick little bit about my class, which is healthcare finance. This is a quantitative class, but it's taught in a very, domain contextual environment. It's 8 weeks. Each week has a theme. Within that week, you move through the content as you choose. Most of it is voiceover PowerPoint, but there's lots of other lecture materials and assets that you can use. I know that topic is new for people, so the content is branched. For people who are very new to finance and accounting, they start with a series of lectures that are called Toolkit that helps build their understanding of basic concepts in accounting and finance. If somebody's already got a background in that and they feel comfortable, they can skip those and go right into the healthcare applied content, which is called the real world. So all of those lectures are clearly labeled, and a journey through the class can be branching or different. depending on what you bring to the table, and allowing you to kind of jump in where you're most comfortable. We do have live office hours every week. My teaching team and I, we try to spread out through the week. We know we have weekend warriors, so somebody's there on Saturday morning ready to work on homework with you. Some of us work on the evenings during the week and some of us during the weekday. So we understand that you're all unique in different time zones and different ways that you want to engage. There are assignments with due dates that hit at a certain place. So while it is an asynchronous class, there are accountabilities that you need to be thoughtful. We also do a couple other live things. We have 2 live learning labs that week, one in week 2 and one in week 6. For example, the week 6 one is about healthcare pricing. It's not required that you attend, but because healthcare pricing is such a spicy topic, people really want to understand, how did that new, drug to, do gene therapy for sickle cell? How do they put a number on that? How do you price a cure? So we talk about those things in kind of an open forum. Sometimes we bring in additional guest speakers. So we do offer those opportunities for live engagement. There's also a very robust discussion board that kind of goes 24/7. It's moderated by the teaching team and by each other as peers. And that ends up being kind of an interesting dynamic there. This class is taught in case-based assignments, and it's a little different than most of our online classes in that it does not have a group assignment. We do a lot of group work in the online program. We think that's important because teaming and teamwork and collaboration is really important. But that class, because for me, I want everybody to come out of there feeling solid in their ability to do the finance. I don't do a group project. I do an individual project. You can collaborate and talk and share with each other, but that's kind of unique. So I'll pause there, can certainly answer any questions about the curriculum in the Q&A, but hopefully that gives you a sense of, what the program might look like from the core requirements into a concentration, and the fact that in HPM with our certificate, we do have multiple ways you can engage with our content, fully joining the concentration or perhaps just doing a certificate.
So jumping from that, the public health practicum is actually a really big piece and component to our program. So what a practicum is, it's a structured pathway for students to pretty much obtain practical experience within the field of public health. So you're learning in real time. That's really a theme within our program. And we want you to be able to practice the skills that you have yourself and sharpen those, but then also what you're learning from your curriculum as well. So the goal of this is to be able to enhance students' professional and leadership development. You have to spend about a minimum of, I would say, 130 hours for this practicum. And it could be spread over a course of time. You can start as early as your second semester, but wrap it up by your 6th semester. So it's a pretty large gap. It's also self-directed with some structured guidance, and that's our operating model. But while we're on the topic of the practicum, I'd love to hear from you, Kim, what some of the projects you've seen happen within the health policy and management cohorts.
Yeah, I'm happy to do that. And as Stephanie's sharing, this is a critical part of the program. It's actually a graduation requirement to have an applied experience. So that applies in the residential program with a full-time summer internship. And then in this case, these minimum of 130 hours. We do have a whole team in our RISE office that supports students in locating these. So some people can look within their current organization and perhaps look for a project that's outside their current scope of work. And allows them to do something within their current employer. But I think a lot of people look at this as an opportunity to do something different. And you can see the breadth here of where people go. Health policy and management students really do go all over the place. As I look in these different buckets, I'd say other than the research one, the health policy management ones tend to be more on the applied side. But you can see lots of nonprofit, health system, and government opportunities. And again, this is another place where a health policy and management student might lean in on trying to gain more management skills, in some cases sort of advisory project skills. Other people look for policy opportunities, so they might be trying to advance or learn more about how policy happens or how policy is translated into operations within an organization. So La Clinica de la Raza pops out at me. It's a health system in that bucket. It's about 2/3 of the way down. This is actually a Berkeley-based, Berkeley-born, federally qualified health center. They've got branches all over the East Bay, very well known. They have an incredibly tight bond with their beneficiaries, those whom they serve. They have a very strong equity sourced model, and they can offer really interesting opportunities to students who want to look at different interventions, as to how to improve the health of a population. They also have a whole group that works in strategy. There's obviously opportunity to learn about how they budget. So it's quite a bit of different ways, some of these organizations that you can engage. Some people are interested in the startup and entrepreneurial community. Other people, again, are interested in sort of understanding sort of think tanks and doing things that might look more advisory or consultative. So quite a wide range of things that people do. And it can be a little daunting, and we know that. And that's why there's a lot of advising by faculty leads like myself, but also the incredible team that we have for what we call our RISE office. And they are well positioned. They pump out opportunities all the time, just outward bound. So even when you're not even actively looking yet, it's great to scan those and see the types of things that organizations are bringing to the School of Public Health as opportunities. And it's a push and pull. You can pull in your own thing, or you can look at some of the stuff and go for some of the stuff that's pushed to you. So hopefully that gives you a little bit sense of how that works.
Great. I will dive into some of the logistic pieces of the program. So we'll talk about fees and tuition. Currently, our program is priced at $1,478 per unit, and it is a 42-unit program. There are some additional fees that come along with the program, such as the Berkeley campus fee. And some folks ask, why is there a Berkeley campus fee if it's an online program? And what I love to share is our online students are Berkeley students first. You are a UC Berkeley student first. So that means you have access to all of the amenities that an on-campus student would have. You have library resources. If you are local, you are, of course, welcome to use the physical campus, the building spaces. But certainly you have access to a lot of UC Berkeley's amenities and resources as well. There's a student health insurance fee. This can be waived, and Stephanie and I can certainly provide more information on that if you're interested. And the total cost of the program right now, if you waive that health insurance policy, is $67,786. All right, and I think funding a graduate degree is obviously, I think one of the biggest parts of deciding whether or not you're going to enroll. So we want to let you know that there are definitely pathways. First and foremost, for those of you that are eligible, there is federal student aid, and I highly encourage you to complete the FAFSA if you haven't already done so. At the graduate level, federal student aid does typically look like unsubsidized student loans. So I always like to disclose that. But on top of that, we have some alternate ways that we might be able to support you in paying for the program. So we do offer several scholarships. We offer the Dean's Health Equity and Leadership Award, which can range from about $1,500 to $10,000. We also have the Rural Health Innovation Scholarship. This is a really exciting, relatively new opportunity that we're offering during our spring semester. So if you're applying for the spring of 2025, that's when our next Rural Health Innovation cohort will be accepted. And the Rural Health Innovation Scholarship covers all of your tuition. In addition, it covers some of your travel expenses for your visits. And there's even an opportunity for those of you that are specifically interested in health policy. There's an opportunity to specialize even further by doing a rural health policy fellowship within the Rural Health Innovation Program as well. So this is a really exciting, fully funded scholarship opportunity that will be available in spring of 2025. And Kim, I don't know if you would like to share any more about the RHI program.
Happy to. I'm very excited about it. It's actually it's a gift from an alum, Lynn Barr. Lynn was a student of mine. I don't know. I hesitate to say how long ago, but Lynn was an amazing individual. She left after getting her MPH, which she found was transformative. She went on to found a company called Caravan Health that's been working for the past several years in rural communities, putting together accountable care organizations to unlock the ability of rural health providers to get more federal funds and to band together, and then to also provide better care. So she was sort of a coordinating and both on the quality and on the funding side, which is kind of what accountable care organizations do. Lynn was an amazing force in that space, and she fully credits her training in her MPH is allowing her to achieve that. She's become a tireless warrior at the federal level, knocking on doors, trying to get money for the rural environment. She sold her company to Signify Health about a year ago. And then you may or may not know Signify Health. They got bought then by CVS Health. And at each level of that, what Lynn built in Caravan and the home presence and the technology has been cited as the key value point of what that acquisition was driving. So could not be more proud of Lynn. And true to Lynn's form, she wanted to give back. And this was what she felt would be the most powerful, to allow people who live and work in rural communities stay in those communities, but to elevate their voice and their impact as change makers in public health through a fully funded MPH. So she's funding 100 people over the next several years. And then as part of, and those people don't have to be health policy and management, by the way. I think the incoming cohort is very nicely split between those who are in health policy and management and those who are in the interdisciplinary program. But then of that, each cohort, there's a subset that is offered the opportunity to apply and advance to being a fellow. And that those fellows are going to get enhanced opportunities to engage at the federal level with Lynn and others, and have a more curated federal policy practicum, again, to advance their ability to have a voice at a larger federal stage, still staying in close contact with their community, but they will have more programming and a somewhat different curated practicum experience. So all of the scholars are this fully funded, but a subset of those scholars that we will curate through an application process after they've matriculated in the program, which we're starting to do now because we do have our first cohort has joined us already. They will go to things like the Rural Health Annual Health Policy Meeting, and have some other experiences. So again, it's an alum, a person dear to my heart. She's actually going to be on campus tomorrow. I get to see her. Very excited about that. But for those of you interested in that program, that's a spring only intake. And so it's great if that's on your radar to be thinking about the deadlines for the spring intake of our program.
Yeah, thank you so much, Kim. And our final scholarship opportunity is the Global Health Leadership Scholarship. This is also a fully funded opportunity that is available this fall if you're applying for our fall 24 cohort. And this term, it's available to one student who is living and working in India. And one thing I apologize, I did forget to highlight on here is employer sponsorship. So this is something we just like to call out because there are many organizations that offer a tuition benefit or a fee remission opportunity. And so we highly encourage folks to reach out to their employers if you're thinking of applying to a graduate program. Explore any benefit that might be available for higher education, especially if you're going to be taking that degree back to your workplace to improve or elevate your work and your contributions to your company. So we have some tips on our website in terms of how you can ask your employer for sponsorship or how to inquire into those types of educational benefits. And certainly Stephanie and I can provide more information there as well. All right, and lastly, I'll go over our application checklist. Now, rather than reading all of the application requirements, which again, certainly we can answer any questions on, I thought I would kind of give you some high-level content and then invite Kim to share, what she thinks makes a competitive health policy management application. But generally, we're going to look, one of the categories that we'll look at is your academics. So we will take into account your advanced GPA, which is your most recent 2 years of coursework. We will look at your work experience, any volunteer experience you have. We'd like to learn a little bit about you through your letters of recommendation and your various essays. And there is an application fee as well. $135 for US students, and for international folks, it would be $155. And then just the last thing I'll highlight is that it is GRE optional. You do not need to submit your GRE to apply. And with that, yeah, Kim, I'd love to invite you to share, what you think makes a strong HPM application.
Yeah, thanks for that. So we really want to understand sort of how the program will, serve and advance your professional goals. So you can see there's a statement of purpose and a personal history statement. And so the way that I differentiate those is the personal history statement helps us understand who you are and how you've come to this moment. That's an opportunity to share, your journey, anything you want us to understand about your achievements, any challenges, anything that would help us better get insight into who you are up to this point. And so I encourage people, don't just restate your CV. We've got that. Use this as a moment to help us sort of bring some color and some context to that. Highlight things you want us to know. It's a great opportunity for us to hear your voice. So that's what I look for. Authentic sort of voice. I feel like when I read that, I get a sense of that person. I'm understanding why they're called to public health and what brought them to this moment. And again, there's a lot of different ways that can go. That could be about their childhood, that could be about family circumstances, that could be travel, that could be an experience they had in college that was powerful. There's no one way to do that, but that's what that is for us. The statement of purpose to me is the forward-looking component. This is where you're helping us understand, why do you want to do this? Why do you want a master's of public health? Why would you want to come to Berkeley? In my case, for HPM applicants, I'm looking like, well, why? What about this curriculum, this opportunity really resonates with you? And how would you build on that to get where you're trying to go? And so that helps us understand, are we a good fit? We're actually very thoughtful about whether we can give you what you say you want. If we know that we don't have the curriculum, the expertise, that will, we want that fit to be aligned on both sides. So it's very helpful for us to know what you're trying to do or achieve through your graduate studies, which we appreciate is a huge investment across the board of time and effort and mental energy. And it's a very personal investment is the way I look at graduate school. It's sort of different than undergrad. And so I want to make sure that we can, we know what it is you're looking for in a program. And if you've already looked at our curriculum, if you've already thought about the community, if you're excited by the campus visit, if the makeup and modality of our program is what you're looking for, then that's where that's helpful for us to know. And it can also tell us how much you understand about this experience and then are self-aware that this is a good fit. So in summary, personal history statement is a bit more retrospective and thinking about where you've come, what you've been through, what brought you to this moment. The personal statement of purpose is that forward-looking. Well, where are you trying to go, and how would this program help you get there? And then whether it's health policy and management, frankly, or EPI or whatever, what about the curriculum or the experience is exciting to you and you can already see would help you build to where you're trying to go? And that could be the practicum, that could be the community, that could be the brand of Berkeley. There's a lot of different components that people will talk about, but that's kind of how I think about using those two. Don't restate stuff we can see. Perhaps explain stuff if you feel there was something in your academic history or professional history that we should understand that we may not get from looking at it, then that's really helpful. But that's where I find them very successful in terms of we really seek to get to know you through those two vehicles.
Thank you so much. Yeah, I think that's incredibly helpful. And that segues well into our admissions timeline. So we are accepting applications currently for both our fall 24 and spring 25 cohort. Our fall 24 application deadline is March 3rd. So if you are on the fence or thinking about applying, you definitely still have time. And Stephanie and I would love to connect with you and answer any questions you might have leading up to that March 3rd deadline. If you have applied or are planning to apply for this fall 24 cohort, if you applied by the priority deadline of January 7th, you should hear back with an admissions decision in probably mid-March. If you are planning to apply by that March 3rd final deadline, you would hear an admissions decision from us by May. And the fall 24 cohort will begin instruction in August. For those of you who might not be ready to apply, or the timing isn't quite there yet, you still have the opportunity to get started on an application for spring 25, and those applications are due in August with instruction beginning in January. All right, and I think Stephanie's going to share a little bit more about our student outcomes.
Yeah, so one of the benefits about our online MPH program is, again, you are getting high quality education and you are learning in real time. And that doesn't stop once you move forward. You're taking all that training and you're moving beyond that. So the average salary of our students that move beyond our program are typically a little over in the six figures here. And some of the job titles that you see here are some of the recent graduates from our last graduating class here that have posted here, from data analyst, senior financial analyst, so forth. We have folks that are moving into Deloitte, UCSF, Stanford University, Dignity Health, and so forth. This is just barely scratching the surface, but I'd love to just check in with you, Kim, and see, if there's anything else to add here that you've seen. I know that you've networked and been a big champion of a lot of our students, to speak up on that a little bit more.
Yeah, I've got two different options. I'd be happy to share sort of people at two different stages of their career. So we had a woman come through the program who was already a physician, primary care physician, and who had stepped away from clinical practice to raise a family and was using the MPH to kind of re-engage. Very involved in the program, really soaking it all up, marinating in it, but not sure what they wanted to do, with the MPH necessarily. And so throughout the program was testing and trying different hypotheses, if you will. We set her up with lots of different informational interviews, because this is obviously someone between the medical degree and the MPH now was really going to have a lot to offer, and you really needed some guidance and a lot of quick conversations to really get that. We here in California have a new Office of Healthcare Affordability that we've instituted at the state government. And this individual, after a variety of different conversations with folks, ended up interviewing and securing what she now calls her dream job, working in this Office of Healthcare Affordability, where she really gets to bring that clinical lens. Also, she would say her whole lens, a public health lens, a lens of a mother, and bringing that into a space where there's a lot of challenging conversations, right, about healthcare affordability, and with the state now trying to be really thoughtful about what goes into the cost profile. And what could be done in concert with industry to be more thoughtful about managing affordability. She just could not be happier. And so that was an example of somebody farther along in their career and their life stage who used the MPH and HPM to go into more of, I would call, a policy environment. A different example is someone who came to us more closely to their undergraduate experience. They worked for a little while. They were actually a double bear. They'd gone to Cal Bear, Berkeley undergrad. They were a student athlete on the basketball team, women's basketball team. So already had a lot of leadership and I think a sense of self about where they wanted to go. Came through the program, and I was really fortunate to get to work with them as they were thinking about what their next steps were. They decided they wanted to be in health administration. And so they went through a process of applying for this series of post-grad administrative residencies that are out there. Most major health systems offer those. And so I got to be her recommender. I wrote her a whole slew of letters and got to help her think about the mission statements that she was putting forward, and excited to say that she got multiple offers as she finished up that process and has accepted one. She'll be at USC Keck School in their health system as an administrative fellow. And so she's going the more that health management route. So again, just two kind of different examples of people. Both of them relied a lot on faculty mentorship and the network to talk to lots of people to shape where they might go. And both of them, I think, ended up in places that they're super excited to be, and will allow them to, you know, continue this journey of being public health change makers. So hopefully that's helpful.
And just getting ready to close out, we wanted to, remind what we are all about. Why choose Berkeley, specifically the online MPH program? So as we've mentioned, we've been here for 12 years and counting. We're a top tier program, and we consistently rank in the top 10 online MPH programs. Our program in itself it's enriching, it is collaborative, it's current, it's challenging, as you've heard Kim talk about this. But even to add, we do a lot of integrative work between something that we didn't mention too much earlier is that our online students can also take 2 public health courses in our residential program. Our students, as Elise mentioned, are Berkeley students first. So you have resources, you have everything that is there in your toolkit to prepare you to be the best public health professional that you can be. The curriculum not only is in an online setting, but you are taking this into your professional settings and into our different environments, local, current, or global. It's wherever you are. And the robust network that we have is over 500 alumni, currently have over 190 students enrolled in our program. And that's just our program in itself, and not expanding to the larger School of Public Health. We also have partnerships with top leading organizations for hands-on training. One of my favorite spaces here is to document our students. So you'll always see me at the summer visits, commencement, or any chance I get to just document our life within the online space. These are students that have gone through our program, and it's such a amazing opportunity to witness students from busy backgrounds be able to still complete a rigorous program. It's exciting to see them have a network and a support system made of different peers who have similar interests, sometimes different interests, and make it to commencement and celebrate together, but move on to what it is that you're called to do within the field of public health. It's a very engaging space, but I want to close this out with sharing our upcoming events. We have the interdisciplinary workshop or info session coming up on February 5th, 2 p.m. Pacific Standard Time. There's many ways to get in contact with us, but I want to leave this space here, more importantly, for you to connect with Kim and ourselves, Elise and I. So I'm going to open up the floor. We'll go ahead and check in the chat to see what questions were asked. But if you also want to unmute yourself and be able to ask some questions, please feel free to do so here. And more importantly, thank you so much for just making the time to connect with us. But let's use this time for Q&A now.
And I can dive in because I saw, Juliet, your question in the chat, and I was just typing out a response, but it might be beneficial for everyone to hear the answer. So you asked, can I apply for an MP or the MPH as I complete my undergraduate health sciences degree in my senior, I'm in my senior year, to enter the program directly after graduation. So you certainly can apply to the program. I will share that we do have a preference for 2 years of work experience. We will accept an equivalent amount of leadership and volunteer experience. And then I will also note that our health policy and management concentration does actually require that 2 years of prior work experience. So for health policy management, we tend to think it's beneficial to have some experience in the workforce. And for our other concentrations, you certainly can apply. We would encourage you to submit what we call a volunteer community service statement along with your application, sharing more details about your community involvement and leadership experience. But yeah, great question.
A question that I saw earlier, and maybe Kim, you can speak to this. Can we alternate between the PACEs each semester? And are these PACEs tracks that we have to select to follow, or are they meant to be guides for scheduling? So they seem to be in a similar
I mean, I think they're more guides. I think I think they're more guides, right? What we're trying to explain is that the program has some flexibility. Like, you may not even know now which track you need. you might end up needing acceleration because you have an opportunity coming and you want to finish faster, or the opposite might happen. You might need to slow down a bit because of something that's come up at work or personally. So I think the message though is that it is flexible. Most people do complete in that sort of measured 27 months, but other people will move more quickly or will withdraw, pause, slow down. So that's really a great dialogue to have with the program management team once somebody matriculates, because you won't even know potentially what the next several years looks like. But the program is, I think what we're trying to say is that we can flex to kind of work with where you are. We understand that life intervenes, and that you're educating in place, and it may or may not be possible for you to kind of hit that steady Eddie pace the same way all the way through, or not the right way to go about it. So that's really where you just stay in dialogue with the program management folks. You can also, by the way, change concentrations. We haven't talked about that, but we do have people who get admitted interdisciplinary and say after the summer one visit, move into HPM or vice versa. So there is also fluidity there after the fact. So none of this is meant to say that you're locked in to either a pacing or even to a concentration or not being in a concentration. So there's time, to sort that out, by, while you're in the program. So I just kind of wanted to make that clear as well.
And I see that we have a question from Chris Christie. I'm working as a public health nurse in HHS, and I'm interested in upstream work. I'm looking at this organization, and I clicked the link, and it looks like it's Johns Hopkins School of Nursing, Institute for Policy Solutions to Redesign U.S. Health Systems. And you're wondering if we have any thoughts on connecting with similar work in California. So it looks like this program is located or based in DC. Kim, I wonder if you have any thoughts on that.
Well, we certainly have faculty who work in this domain. I might call out Hector Rodriguez, Professor Rodriguez. He's faculty, as am I, in both residential and online. He teaches in the organizational behavior. He's part of a research center called Choir, and they spend a lot of time looking at system structure, what influences, optimal care delivery. He has a personal interest in multicultural health and also looking at how technology engages with that. So there's other faculty that look at sort of leadership constructs. So I think that's really where exploring the list of the unique research groups that take place. Like I said, I'm part of a research unit, but mine's more about how do you scale in an affordable, equitable way, biomedical and technical innovation. So different faculty are aligned in different groups. And there's actually also healthcare-oriented folks on campus who aren't in the School of Public Health. Berkeley's a pretty big place. Healthcare is a very important area. So there's healthcare classes in the School of Law, the School of Business, obviously our friends in social welfare, public policy. So I think looking at the list of different research units and seeing sort of, well, what is the sort of transformational work? We also have things like the Right Care Institute and other sort of advocacy groups that make their home or have a home base on the Berkeley campus. So there's, I think, different ways to see how system reform and system change is happening through research and advocacy. Something exciting that we haven't talked about is that the Berkeley School of Public Health just hired our first Chief Social Impact Officer. So we've just welcomed Claudia Williams to the sort of the Dean's Cabinet of the school. We're very excited. Claudia has deep background. She actually, I think, has a degree from Hopkins, but she has a deep background at the federal and state level, trying to affect system-wide change. We're very excited to partner with her. Her sort of purview is going to be about looking at how to amplify the school's voice and impact through different partnerships, community, government, industry. She's just started this week. Everybody's getting to know her. I've known her for a while through some other channels because we overlap on a lot of interests, but I think those are the types of opportunities that students will see even more of about the different ways to make impact.
That's great. Thank you. And another question is, does the minimum 2-year work experience need to be completed before we start the program?
I would say, if you're right on the bubble, I would still apply and just give us that impact statement of why you feel ready and what you're bringing with it. I think our point is that you're interacting with lots of working professionals who are going to have quite a wide range of experience. So we want people to feel comfortable being able to hold their own and hold space in classes and feeling like it's a community they feel they can connect to. So if you feel that you want to demonstrate that you can, that feels comfortable and exciting to you given where you're at, then share that with us. I guess that's how I would say. I never let a good requirement stop me from doing something. So I would say throw your hat in the ring if you feel like you're at that place where this program feels like what you want to do. But just know that the program is largely made up of people with 2 to 35 years of work experience, and a lot of them heavily in that 8 to 15, 7 to 15. So that's the community. So you just want to make sure you feel like it's a community you can join effectively and authentically. So that's kind of what we're about. It's that fit component. I see another question. It's probably one for me. Overview of testing and grading. It's going to be different in different classes, to be honest with you. We do use exams. Sometimes those are timed exams that are done through our Canvas site. Sometimes those are take-home assignments. Different faculty have different approaches. My pedagogical approach in finance is that I don't use problem sets. And as I already mentioned, I don't use group projects. But we do a lot of group project work, a lot of writing of reflections, short papers. I think there's going to be different modalities for different classes. So obviously biostatistics and epidemiology, they've got exams and problem sets. That's more of a classic example. Other classes, particularly, we're really asking you to synthesize information. Those are going to have a broader sort of pedagogical remit. We don't have a grading target. At the business school, for example, anytime I teach in my classes there, the class can have no higher than a 3.5 GPA. So that really bounds the grades that can be given. We don't have any kind of construct like that in public health. We try to be very explicit with posting the rubrics. So how are you going to be assessed so you know in advance? And then there's always a lot of dialogue if people feel like what they submitted perhaps wasn't fully considered or wasn't given what they need. We're also pretty flexible. We understand you're all working professionals having so I'm very lenient about extensions when I'm told in advance. As long as somebody approaches me and says, hey, Kim, I have a horrible week at work. There's no way I can get homework 2 in on time. Could I get a few extra days? I'm more than happy to give that. I just sort of ask that you let me know in advance. And I think a lot of my colleagues are similarly flexible about that. So hopefully that helps.
Okay, and I see there's a question about letters of recommendation for folks who've been out of a school setting for many years or in the workforce for many years. So we want to see either professional or academic letters, but of course, if you have been out of school for 10 years, certainly give us professional letters of recommendation. You don't necessarily have to give us an academic letter if you're not in contact with your former professors and things like that. So that is completely acceptable. And I do want to be sensitive to time. I know we are at 10 o'clock. So I want to thank everyone for joining us. Kim, we really appreciate your time today and sharing with all of us. I know there are a few questions we didn't get to. So for those of you, if we weren't able to answer your question, please reach out to Stephanie or myself. You can reach us at online.mph@berkeley.edu, and we can throw that email in the chat. But we would be more than happy to answer your questions via email or set up a time to meet with you and talk more. So thank you again for all of your time. We hope you have a great day. And thanks again, Kim, for joining us.
Thanks, everybody. Thank you.